front of the maxilla is called a macroagnathia. So, in evaluating her face, let's look at her lips. So open a little bit. So, I mean, her lips are okay. The rule for beauty is symmetry and contrast. And what that means is this side of the face should be the same as this side of the face. And in this case, with lips, 1, 2, 3, 4, all 4 sections should be the same. The brain likes to see symmetry. I know some people teach this should be, 2 out of 3, this is 3 out of 3, this should be 2/3, this should be 3 out of 3/3. And, that's not correct. That's not how the universe is built. You don't see anything in nature that's lopsided. Everything is symmetrical. The clavicle, the breast, the abdominal rectus, the femur, the humerus, everything. Why would the lips be an exception to everything in the body and everything? Have you ever seen a rose that's off or a daisy that's, lopsided? It's just dumb. Whatever doctor's teaching symmetry is not part of beauty, stop it. Symmetry has always been part of. Look at the stripes of a Bengal tiger. Look at the dots of a monarch butterfly. Look at a daisy, the petals of a daisy. If you take a daisy and you cut it in half, you can fold. There's the same number of petals on one side as there is on the other side. So if you have a problem with that, argue with God, because I don't make daisies. He does. So based on what I just said, when you draw a line in the middle, 1, 2, 3, 4 should be the same, like the Bengal tiger, like the monarch butterfly, like a rose, like the daisy, like the rings on Saturn, like everything in nature. The lips aren't going to be the only exception to the entire universe. So we cleaned it, and we're going to clean it again right now. And if you see, open. So this is a little longer, see, than this side. It's hard to elongate lips because that's anatomical, but she's just, she has a little bit of a, larger side here than there. So this is, hypoplastic a little bit on this side and hyperplastic, and that's pretty normal, where one side of the face is a little bit larger than the other, and that's probably why the lip is longer here. The lip is longer here, and the lip is longer here than it is here. So if I were to measure this, let's say this is 2 inches, and this is 2 inches. This is probably 1.5 and 1.5, and that's consistent with this side, being hyperplastic or a little larger, and that side being hypoplastic, based on mesoderm, endoderm, and ectoderm histologic, development in utero when you're born. It has nothing to do with what side you sleep on. A pillow's not going to change the shape of your face. That's bone. So what we're going to do to create symmetry is we're going to add filler to this side to match that side. It'll just make it a little longer and a little bit bigger. And then you see how this side is a little bit more plump and full. And then we're going to put some filler on this side. The contour here in the 3-dimensional plane, you see how there's a little bit more projection here, which means it's a little bit more voluptuous here and than it is here, which is normal. You see, show on the lateral view. Yeah, so you see how in the lateral view, this sticks out and goes out more round, and then this kind of goes back, and it's not as round and full. So we're going to make both of these round and full to match the round and fullness of the lower lip, and we're going to add a little bit here to match the size of the longer and bigger side. Basically, you're making all 4 sections of the lip the same. If you guys remember, I told you a story of the plastic surgeon that worked on my nose, and he cut my lower lip without even having a consent, because he knows that beauty is symmetry and contrast. The contrast, another word for contrast, is pop. Larger lips are more attractive than smaller lips because they're an element of beauty in society. But it can't be too big because we're not ducks. It has to be balanced and symmetrical.